According to new research of the American Cancer Society, cancer deaths have fallen into the lowest rates since 1991. This is great, Sasha, it's great news, but at the same time, there's some more information coming from this same research that forces us to take a measure when reading this. Let me tell you, according to this information, the 2012 cancer death rate in the United States was 166 deaths per each 100,000 inhabitants of the country, compared to the 215 deaths back in 91. So definitely there's been an improvement. There's a decline in the cases of cancer when you lump all the types of cancers together. And that's where we really need to be careful, because they also saw the increase on the disease on different types of cancer, colorectal cancer in those younger than 50. That is a population that normally does not get screened for the disease. Types of cancers in the neck, the tongue, and the liver are in the increase. So yes, we're seeing less people dying from cancer, but in 2016, we're expecting 1.7 million new cancer cases in the United States.
Well, there are a couple different factors at play here. One is the increase of access to affordable health care that's happening across the country. So people are getting out there, and the cancers that we know of, leukemia, right, breast cancer, all of the marketing that's behind that, people are getting screened for that. But to your point, colorectal cancer is not something that you hear about. We don't often hear cases of it being reported, and when we do, they're very extreme. And with a lot of cancers, early detection is the key to successfully beating it.
Exactly. And especially with the younger populations where they see the uptick, because after 50, it's a common screening, but they say, well, we are seeing that if you lump all the information, yes, we see hope in the future where we see less people dying from cancer, but at the same time, there's certain cancers that are on the uptick, but at the same time, they are happy because this type of information, this data, allows to develop public health measures like the ones you mentioned about who do we need to target to give the information about screening, about health. They also are talking about the amount of people that is not smoking anymore in the country as a good reason why there's less people dying of cancer. Better screening techniques, more access to healthcare, like you mentioned. I think it's a great moment in medicine to beat this disease. And at the same time, like we mentioned, we see a lot more of these cases because we've been able to extend the life expectancy. And before, if you were 50, your heart will give up. Now we kind of move away from being defeated by the heart disease, and now we're seeing more cases of cancer at a later age, but at the same time we're seeing less people dying, which I think is always a good thing to celebrate. The American Cancer Society revealing that we are seeing the least amount of people dying since 1991 in the face of cancer.